What's up, rookies? Welcome to another snippet on what pharmacists do. And this is another one of our rotation reflection series. And I'm really excited to have Avneet with us, who is going to talk about his institutional rotation at Contra Costa Regional Medical Center. Avneet, thank you for taking the time out of your restful Sunday to come over and share your experiences with us because we want to create a library of pharmacy rotation experiences that students can relate to, connect to, um, and learn and kind of prepare for their own, rotations in the future. So this is an institutional rotation series, and I'm so glad that you're here to share your experiences. But first, let's get to know you a little better. Can you share some background information about yourself? Why did you decide to choose pharmacy as a career, and where are you on now on that journey?
Okay, thank you for having me. My name is Avneet. I'm currently a third year pharmacy student at Turo, and I just
Almost
completed
there. One more year to go.
one more year.
Yes.
And I just completed my institutional at Contra Costa Regional Medical Center.
Yeah.
So I went into pharmacy so growing up, I've been really involved in my community.
Mm-hmm.
So seeing the impact that pharmacists have, I really wanted to go and later in my life go open up a nonprofit clinic and just help out in my community. And
Okay.
I've seen people do it even in undergrad. I was able to open up a club and make an impact. So as a pharmacist, I hope to make even a bigger impact in my
Okay.
community one day.
Okay. Okay. You want to make a community impact. And I only know this because you were on the rotation with me and you have a sister who's a pharmacist, right? Did
Yeah.
that have anything to do with your career choice?
So yes, I did get to see firsthand the
Mm-hmm.
impact because before that I wasn't sure what pharmacists did because we usually saw them in the retail setting, but
Yeah.
she is more of a clinical pharmacist. And
Yeah.
when I got to hear her and talk to her about what she did, it just
Mm-hmm.
opened my eyes about what pharmacists can do in the scope of pharmacy. And I
Yes.
just instantly fell in love with what they're able to do for patients and just people in the community.
Exactly. That's why we do these little snippets because not everyone's lucky to have a sister who is a pharmacist to
Yeah.
get that broad picture of what pharmacists do, right? Or can do. So if you want to know what pharmacists do, guys, or get an idea, just check out our prior videos. We talk to pharmacists from various backgrounds and they share their experiences. And you can kind of get inspired and help make a decision as far as your career path is concerned. So now, Contra Costa Regional Medical Center, institutional rotation. Can you share logistical details about your rotation? How far in advance did you have to contact your preceptor? What was the dress code like? Is parking horrible? Your daily work schedule, just like general logistics about the rotation.
Okay, so Contra Costa Regional Medical Center, I reached out to my preceptor about 4 to 5 weeks prior to the start of my rotation, and I
Okay.
sent an email about dress code, parking, about what type of topics I should prepare for.
Mm-hmm.
So I had a heads up on what I'm going to be encountering there day to day.
Okay.
So
Okay.
when my preceptor got back to me about the concepts, I try to review a little every day before I got there, and the dress code is usually professional. You can
Yeah.
dress professional, have a white coat on at all time and a name tag. So,
Yes.
so
Yes.
the
Name tag.
physicians and
Mm-hmm.
nurses, they know who you are when
Mm-hmm.
you're walking around
Mm-hmm.
the hospital. And my day-to-day schedule, so is it was split into two shifts, 3 weeks and 3 weeks. The first 3 weeks, you're working one-on-one with the pharmacist more and the techs, and you get to see the workflow and you get to see
Yeah.
what they're working on. And the
Mhm.
second 3 weeks was based on med rec and admissions and discharge. So you get to follow the patients from admissions all the way to their discharge, and you get to
Yes.
see what medication they're taking on at home versus what they're taking in patient and what they're here for.
Mhm.
And then when they're discharged, you get to talk to them about their discharge medication. So you get to see a whole journey of a patient from admissions to discharge, which I thought was really cool.
Isn't that cool that you can track the patients from the emergency room during the admissions process and then see what's going on while they're admitted, and then when they get discharged, you talk to them about their discharge medications. So you kind of following the life of the patient there throughout the admission. So you did mention business, dress code, reaching out to you reached out to your preceptor 4 to 5 weeks before, which is really good, which gives you enough time to prepare, just because you did ask about the topics that you need to review and to study. But yeah, for every pharmacy student going on a rotation, you do want to reach out to your preceptor way in advance to know about, because some sites want you to get certain immunizations, background checks, and those things can take a long time. So you do want to be prepared well in advance. All right. And that sounds like a pretty good exposure. It's an institutional rotation where you're supposed to learn about the workflow in the institution, in the hospital setting. So you not only got that by being shadowing the pharmacy technicians and the pharmacists one-on-one, and helping with the daily workload, but you also had that half of your rotation where you were doing kind of a transitions of care, working on admissions, medication reconciliation, and transitions of care, medication reconciliation. Awesome. Walk us through a typical day during your rotation at CCRMC, and what were your primary responsibilities. And I'm always curious to know, are there any standout projects that that impacted you that you would want to share?
Okay. So usually my day started at 7:30, which is the perfect time to find parking at CCRMC.
I know.
Usually before 8, you can find parking there. So that's the best time.
Yeah, if you gotta start at
7:30.
11:30 or later in the afternoon, everyone's there and it's a mess. Yeah.
Yeah.
Good point.
So I started at 7:30, and then for my second half of the rotation, the admissions, you would go through the patient list that was admitted, and you would either see if they filled the inclusion criteria to work them up, or the exclusion criteria based on what the exclusion criteria is for CCRMC.
Yes.
Based on that, I would print out those patient lists, and then I would speak to my preceptor of that day, and then I would just go over the patient if they do fit the inclusion criteria and they found the same amount of patients I did. So after we speak about that patient, I will usually work the patient up, why they're here, their past medical histories, what each medication was being used for that they're here inpatient, and the medications that they're not on from home and why they were stopped usually or inpatient. And then I would also reach out to their pharmacy, get their medication list to see when they recently dispensed the medication to match up. Is the patient here for non-adherence? Is the patient here for another reason? Just to figure out the whole story. And then we would speak directly to the patient just to match up their medications, how they're taking it. Is it different than what was listed on our list?
Yes.
And from there, we would just go into APPE and just put in all the information. And we do that for every patient. And then that will be up to lunchtime, a little after lunch. Then after lunch is when you start taking more onto the discharge patients. And then the same way, I was given a couple of discharge patients by my preceptor. We'll work them up, present them to my preceptor, and then I would tell them what I would say to the patient, and then they would either give me advice or they would say, okay, go ahead with this, just call them. And then you would just speak to the patient and just remind them all about their medications and their upcoming appointments. And this was a good transition since I'm in my acute care. It taught me how to work up patients, because now when I'm working up patients and presenting to my preceptor, I was able to learn a good flow, how to go. Because in school we're taught just so, but here in the hospital setting, presenting a patient is totally different to a preceptor. So I was lucky to have that experience prior to my rotation now. And as well, this rotation helped me because I'm still doing med recs in my rotation right now. So it was a perfect transition.
So we prepared you well for the future.
Yeah, definitely.
Okay, so you talked about because it's a 6-week rotation, and at Contra Costa Regional Medical Center, we split that 6 weeks into half. And you talked about the 3-week half where you do transitions of care, and you talked about your admissions medication reconciliation and your discharge medication reconciliation. We have inclusion criteria that help you decide which patients to work up, because we cannot work up every patient that's being admitted, right? So there's some patients on some high risk medications that pharmacists take a look at. So you got really familiar with those patients. You got really familiar with doing the medication reconciliations, comparing what they were taking at home, from what the provider was starting in the hospital, and then presenting that to your preceptor in a coherent fashion, which you did a really good job with. And the second half of the day, when we were done with the admissions medication reconciliation, you were working on the discharge medication reconciliations for the opposite, patients on the opposite end of the spectrum, patients going home, right? And you were really helpful with that. How about the other half, the half where the other 3 weeks where you were doing the real institutional part of things? What was your
So the other 3 weeks, my schedule varied based on the pharmacist I was working with. So
yeah
sometimes I would start at 7:30 if I was with the discharge pharmacist,
yeah
or I would start later at 9:30, depending on the pharmacist I would shadow. And I would
This
just
is
say
when
those
parking started to get really bad, right?
that's when you had to find parking on the street and walk to
Yeah,
Center,
yeah.
all right,
Yeah,
Contra Costa. But
yeah,
I I just that experience was really valuable because just seeing what pharmacists do day to day and just seeing the different medications and the different indications they're used for, I think was really helpful because that was the first time
yeah.
you get to see them
You
up
get to
front.
put your eye on the medication. In school, you
Yeah,
talk about ceftriaxone, third generation cephalosporin, but now you get
yeah,
to see it, and it makes things stick a little better. Yeah. Mm-hmm.
yeah. So I actually love that part where I just got to see how the pharmacists work, and then just being able to ask them questions like, "Oh, why is this medication used?" Because sometimes in school you don't realize that these medications have so many indications and such small indications that you just kind of brush up upon that you see in the hospital used more often.
Absolutely. Yeah.
So it was just
Yeah.
cool to see that. And then I would just ask them questions, and everybody's super helpful, willing to help every time,
Mm-hmm.
take out their time to explain
Mm-hmm.
this is this. And they would ask me questions where I was able to answer and actually write. I brought a little notebook with me, write the answers to questions, which I'm still being asked at my current rotation. So
Yeah.
that those stuck with me, helped me expand my knowledge base.
Yeah.
And then with the text, I was so usually there's a pull time twice a day where you help fill the medication that are going to go up to the hospital for the patients, and you just
Mm-hmm.
help pull those based on what is needed.
Mm-hmm.
So I think that's a really cool experience because I've never seen that. I do currently work as an intern, but in a retail setting. So
Mm-hmm.
this was a totally different side of
Mm-hmm.
seeing how
Yeah.
techs work and
Yeah.
seeing compounding for the first time in my life was
Yeah.
really cool. Just
Yeah.
seeing how
Yeah.
IV bags are made, seeing how everything is made, seeing how everything is calculated, how
Yeah.
everything is put
Yeah.
into a bag. So I think that was a really, really cool experience for me
Yes.
to have.
Yes, I do remember you saying that it was pretty cool, seeing that hospital workflow, because you had worked as a pharmacy technician in the community setting, as a pharmacy intern in the community
Yeah,
setting, and you were very familiar with that workflow, right? The patients drop off prescriptions at the drop-off window, someone types it in, the pharmacist verifies it and, calls if there's any issues, and then the label prints and you fill it, and then we
yeah,
sell it to the patient, we consult the patient, right? But in the inpatient setting, it's kind of a similar situation, but completely different, where the patient does not drop off a prescription. The patient goes to the emergency room.
yeah,
And then in the emergency room, orders are placed, and those orders come to the pharmacy. And from the emergency room, they can get transferred to different units, right? And you learn about the different units. You learn about the emergency room, the psychiatric unit, the med surg unit, the ICU unit, right?
yeah,
And depending on where the patient is, all those orders come into the pharmacy. So by shadowing the pharmacist, you get to hear that and understand that, that this is how it works in the hospital. and you got to know about the first doses, the card filled doses. When you talked about the pool, we have to restock the Omnicells. Nurses get medications from the Omnicells. They don't magically appear in there, right?
Yeah. Yeah.
You had to help the pharmacy technician pull those restock pulls
Yeah.
for the pharmacy, and you went up with the pharmacy technician to
Yeah.
restock the cells. When a pharmacist verified an order for a ceftriaxone, the label would print, and you got to take that label, find the ceftriaxone in the pharmacy,
Yeah.
slap the label on it, and you got to even walk the drug yourself
Yeah.
to the unit. So you got to really get that workflow in
It was
within.
very hands-on.
Yeah,
Yeah.
very hands-on. And it opens your mind to something different, right?
Yeah.
And that's the goal of rotations, for you to see how things work in different settings, and make your own decision as to where your career path where you want to take your career path.
Definitely. Yeah.
Yeah. Okay, good. So now let's reflect on some challenges. We're all talking about good things here. I learned so much,
Yeah.
had fun. But what were some challenges that you faced during the rotation, and how did you overcome them? Were there any crazy, unexpected learning opportunities? Anything memorable that you want to share with other students out in the
Yeah.
world?
So memorable. It started from my first day where
Mm-hmm.
I got to meet my preceptor, Sonam, and she welcomed us really nice, and then boom, we were presented with an exam. And that's where the challenge began, because I thought I knew a lot until I saw that exam, and the exam was given to me. And that I'm really grateful for that exam, because that
Okay,
actually
hold
taught
on,
me.
slow down. When you say exam, people are gonna start freaking out here. Um, and that's something maybe we should have mentioned in the beginning, because the point here is to help other pharmacy students get
Yeah,
ready. So pharmacy students, if you're gonna go on a rotation at CCRMC, there is, I wouldn't call it an exam, it's an assessment test,
assessment.
right, of
Yeah.
the current level. All right, go ahead. That was a surprise. Okay, let's talk
Yeah.
about that.
So that assessment I'm really grateful for, because it actually taught me what I'm going to be working with day to day, and it taught me what I needed to work on when I got home. So
Yeah.
whatever my baseline was after that, we
Mm-hmm.
we discussed it, and then I took that as a blessing in disguise for me. I wrote that down in my notebook, the
Mm-hmm.
topics that I needed to review,
Mm-hmm.
and honestly, that made my rotation going further so
Mm-hmm.
much more easier, because I was able to get the most out of it. I wasn't standing there just
Mm-hmm.
confused about what these certain medications are, what
Mm-hmm.
the dosing is, or certain things like that. So
Yeah.
I would say that was the first challenge I had to
Challenge.
overcome. But it was a one that actually helped me
Yeah.
throughout my whole rotation, and I was able to learn from that. and
Yeah.
and then from there, the other challenges, I would say, more sort of just seeing different disease states, because in the hospital anybody can walk in with anything, so it's better to have a broader knowledge than
Mm-hmm.
just such a narrow knowledge. So
Yeah.
that's what I learned about hospital, that you might encounter more things than some other ones, but you can see anything on any given day. So I would say that was my challenge, is knowing enough. So if I didn't, I took that as, okay, I'd have to go home and review it, rather than this
Yes.
is too hard. So
Yes.
I just
Yes.
approach everything with a positive mindset. And yeah, those were my challenges,
Mm-hmm.
just
Mm-hmm.
seeing different things every day and just being able to learn about them. And the pharmacists were really helpful, where they would sit down with you and talk to you about everything, rather than, just putting you on your own. And I was really grateful for that, because they ease you in and they have a positive attitude about teaching. And as long as you have a positive attitude about learning, those
Totally.
challenges
Yeah,
feel
you
like
can.
lessons that you
Yeah.
can use in your
Yeah.
career.
Yeah. I'm so glad you said that, because that's a challenge that every student is going to have, because every student, or should I say, no student knows everything,
Yeah.
and not even any pharmacist knows everything, right? So for you to be humbled by that assessment test is good, because
Yeah.
it shows you how much you don't know, and it shows you also what we expect you to know going forward for the rotation. And you took it well. You went and studied more, right? It shows that you had to study more. And throughout the rotation, the same kind of challenges came up where preceptors would ask you questions that you don't know the answer to, but you didn't take it as the preceptor trying to stress me out or trying to whatever, but you took it as, okay, I need to write this down and go home and study and be prepared when this question comes up again, maybe at the same rotation, maybe at your next rotation. So it's going to be a challenge for every student handling situations where they don't know everything or they don't know what to do, and having that mindset of it's okay, I just need to take note of it and work on it, right?
Yeah, definitely. Definitely.
Okay.
Yeah.
Awesome. I'm glad you mentioned the assessment test, because now students know that there is an assessment test.
Another challenge I would say
Yes,
that
please.
I thought about was, so the TPN, so shadowing the pharmacist and working with TPNs is a different experience inpatient than school. So I think that was something really cool because at first I didn't know how it works. And now this rotation, I'm responsible for doing those myself, the workups for the TPNs, and they have the same system as CCRMC. So learning that, I think, helped me, that challenge, as I was able to encounter it at CCRMC, helped me in my future rotation, because now what the pharmacists do there, I'm doing by myself. So I think just being engaged at all times and asking questions, because I would ask questions every day to the pharmacist that was responsible for the TPN about, why did you guys choose the increment of increasing or decreasing by this much? What was your reasoning? Why this over that? Why using this electrolyte? Why not that one? And then just learning things like that really helped me now, because now I'm making those changes at my current rotation. And then I'm presenting that to the pharmacist. So just having that background of seeing what the pharmacist thought process was, and I'm able to use that here, I think was really cool.
I'm so glad you mentioned that, because now pharmacy students know that they're going to learn how to work up TPN patients. We have patients that can't, that have extra nutritional needs and need either total parenteral nutrition, TPN, or PPNs, right? And you came on at a time where pharmacists at CCRMC were taking on a bigger role with TPNs, because we used to have dietitians do most of the work, but then you came on where pharmacy technicians took over some of the dietitian work, especially with adjusting electrolytes, and now it's helping you on your on your next rotation. And so that's how students have to know that things build up. When you learn something, it's not over. It's going to build up for your next rotation and the next and the next, and eventually the board exams, and eventually your career, right? Okay. Now, my favorite part, can you offer advice for students preparing for similar rotation, including maybe what topics to study, and what does it take, in your opinion, to do well on this type of rotation?
So my advice would be, first reach out to your preceptor in adequate time about what you need to know, at least for a baseline, because that's going to be really important. You usually hit the ground running in rotations day one. It's not, there's no ease in process, because you have very limited time to learn. 6 weeks, and those fly by. So I would say just go over those topics before and then build upon that. Then that would be my first advice. And then my second advice would be study every day. Anything that you see in the hospital setting that you don't understand, ask questions. Don't be scared to ask questions, and go home and review those topics, because those topics are going to come up over and over again in the hospital. And I would just say, if a pharmacist asks you a question and you don't know, it's okay not to know, but go home and study and get back to them and learn about that more. It's okay. I think the questions help me a lot, because just I learn by talking, I learn by asking questions. So those questions I've probably been asked those same questions 2 or 3 times on my new rotation, and I was very well prepared to answer those, because those stuck with me. Those conversations stuck with me. So just always have a positive and learning attitude. You're there to learn, because this is what we're going to do in our career for the rest of our lives. So just this is going to come up in our careers many, many times. So just have a positive attitude. Don't be scared to ask questions, and don't be scared not to know anything, but just take that, learn about it, and then get back to your preceptor. I think that's the
Yes,
most important part. And
yes.
then the the topics that I encounter the most, diabetes, heart failure, a lot of cardio topics.
Mm-hmm.
Those are the main ones, like the cardio topics, diabetes, hypertension, a lot of topics like that. I would say just have a baseline, anticoagulants.
Yeah. No.
Yeah,
Yeah. Yeah.
yeah,
Yeah. Okay, I'm hearing three things here. I'm hearing study, study, study.
definitely.
And you did mention the topics because those are the main disease states that bring patients to the hospital: diabetes, hypertension, heart failure, COPD, and infectious diseases,
Yeah,
pneumonia. Your antibiotics, right? So study, 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 and take questions that you don't know as incentive to study even more, right? And you
definitely.
mentioned the positive attitude. That is absolutely important because there's nothing that turns off a preceptor more than a student that you can just get that vibe that they just want to get through 6 weeks and get out of there
Yeah,
because maybe they have other plans for the future that don't involve being in a hospital. But you still have to have, no matter what your plans are, you still have to have that positive attitude.
definitely.
Did mention getting back to your preceptors. Um, that is an amazing advice. And I would even add getting back to your preceptors within 24 hours to show that you went home and you studied and you looked it up and now you know the answer. And then now, because for us to ask you another question, we need to know that you've mastered this topic so we can build up on it, right? So it's only also for your own good.
Definitely.
Amazing tips, amazing advice. You were an amazing student. You had an
Thank you so
amazing
much.
attitude. You learned a lot. You asked so many questions, and that's another advice that you gave. Ask questions when you
Yeah,
don't know. So I thank you so much for coming on and sharing your experiences with us. And
so
this is a call to action for any student out there willing to come on the Ricky Pharmacist podcast and share your experiences so that we can build a library of pharmacies, a video library of pharmacy student rotation experiences and help other students preparing for the same rotations. Avneet, thank you so much. And until
thank
the
you for
next
having me.
episode, you guys stay blessed. And don't forget to subscribe and like the Ricky Pharmacy channel. And until the next one, stay blessed. Bye-bye.
All right.